Magnesium sulfate, also known as MgSO4. Magnesium sulfate is indicated for the treatment of hypomagnesaemia, hypertension, preterm labor, torsade de pointes, asthma, and as a prophylactic anticonvulsant in pregnancy with preeclampsia. Magnesium sulfate works as a magnesium supplement for the body. The therapeutic classification of magnesium sulfate is a mineral and electrolyte replacement or supplement, and the pharmacologic class is a mineral electrolyte. Special considerations for nursing include using caution in those with renal insufficiency, that magnesium sulfate in high doses may lead to decreased respiratory rates, arrhythmias, hypotension, and muscle weakness. There should be careful monitoring of EKG, respiratory status, and magnesium levels, especially while on IV therapy, and that doses for IV administration should be double-checked by a second practitioner. In the case of magnesium overdose causing toxicity, the symptoms you would normally see would be respiratory depression, decreased cardiac output with a possible cardiac arrest, and a loss of deep tendon reflexes. If these occur, calcium gluconate is the antidote. It is important to note that when used orally, magnesium sulfate, as a divalent cation, may interact with fluoroquinolone antibiotics. Therefore, these oral agents should be separated for several hours before or after administration of one another. However, this interaction is based on binding within the GI system. Therefore, if one or both agents are being given intravenously, this interaction is no longer clinically relevant.
This has been another episode of the Nursing.com MedMaster Podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.